Hello and welcome to ECHOMAP, the practical, easy and above all useful ultrasound tool for general practitioners. So today, we're not talking about a clinical case per se, but rather a brief review of prostatic echoanatomy. So if you like this channel, give me a like, subscribe to the channel, and let me know in the comments if I haven't made myself clear or if I've got things mixed up in my explanations. And it's always based on real authentic clinical cases. So join us on Facebook. Your introductory ultrasound training course is offered. The link is in the description. I really invite you to click on this link to get started with ultrasound once and for all, and begin this exciting journey and do your patients a great service in the process. So I told you no clinical cases. For a change of pace today, let's talk about echoanatomy of the prostate, because we're always hearing about central zones, transitional zones, anterior fibrous zones, and peripheral zones. And it's true that it's complicated. This is an anatomy diagram, so it's easy. But it's true that it's a bit tricky to get your bearings. When you simply scan your patient, you tell yourself, but finally, let's say I've located a cyst, where is it? Is he in the transitional zone? Is it in the central zone? It's always a bit tricky to find your way around. There are always differences between anatomy and echoanatomy. So I'm going to give you a quick rundown to help you move forward and make progress on prostate echoanatomy. On the plus level, on sections that will ultimately resemble your classic anatomical sections, you notice that an anterior zone is logically prominent on a cross-section. At the back, we'll have what we'll call a peripheral zone close to the rectum. At the central level, it will logically bear its name, the central zone, and then between the two, that famous transitional zone, which will end up being a little like this, in the form of two lobes that will surround the urethra, and will be responsible for our patient's dysuria when this transitional zone swells in prostatic adenomas. The bladder is shown here in the sagittal section. So our patient has a full bladder. He's peeing like this, so it's going down the urethra. Well, here we are finally in the anterior zone. The peripheral zone will ultimately be the most inferior part. We'll come back to the comparison between these diagrams and sections in a moment. The central zone will be the area that ultimately follows our ejaculatory ducts, along the seminal vesicles. The transition zone is the area that finally surrounds the proximal urethra, and will be responsible for dysuria and also prostatic protrusion in prostate adenomas. That's right, it's McNeil's anatomical vision that was put forward for prostate ultrasound. Let's compare what we've just seen. You'll see your bladder in front and your prostate just behind it, wedged between the bladder and the rectum. Well, we're going to have the anterior fibrous zone, which will be located anteriorly, as close as possible to the bladder and as close as possible to your probe. Between the two lobes, two transitional zones surrounding the urethra that you'll most often be able to spot in your prostate. The central zone, just a little bit behind, of which not much can be seen on a cross-section. And the peripheral zone, which will be located as close as possible to the rectum. This is the area of particular interest to us in the search for prostate cancer, even though ultrasound is, in my opinion, a very poor tool for diagnosing prostate cancer. So, let's pull back the cover just a little to see. So there you are, noticing your classic cut. Forward, our anterior zone. The two circles you can see here are in fact the transition zone, which is quite swollen in this patient whose prostate measures 60 grams. And back here, sometimes it's hard to tell whether it's part of the prostate or not. Is this a prostatic zone or not? Here, with a slightly different echogenicity, we see this peripheral zone, the most posterior of the prostate, in direct contact with our rectum. So you can see that in fact the prostate is this whole area here, which includes both parts, the transitional zone and the peripheral zone. On a sagittal section of the prostate, this time in the anatomical direction, with our patient's top and head here, and our patient's feet, the bladder will have this characteristic shape, with the urethra, which will have this equally characteristic shape, a little angled, where it will go, obviously here, towards our patient's penis. Ahead, we'll spot a tiny bit of the anterior fibrous zone. Around the urethra, the part, as we shall see, that is most often difficult to explore because it is hidden by the pubis, which will pose diagnostic problems, particularly for prostate tumors, will have this peripheral zone. And along the seminal vesicles, you'll have this transitional zone that follows our ejaculatory ducts along the seminal vesicles, which are most often well visualized on a prostatic ultrasound. We're going to remove the image. So as we can see here, the urethra is generally quite difficult to visualize. We have this rather hypoechoic transitional zone, which is quite clearly visible here. We'll have the central zone along the seminal vesicles, which will ultimately follow the path of the seminal vesicles located here. And the peripheral zone with a slightly different echogenicity, which is often poorly seen, particularly in its most inferior part, since here we have the shadow of the pubis masking this peripheral zone. So there's always a way to angle the probe just a little bit more, but it's still an area that's the most complicated to explore. So here you see an increase in the transitional zone, which is clearly visible, which is the most visible part of our patient's prostate in the context of a prostatic adenoma. So that's it for this ultrasound anatomy video. As you can see, it's not easy to reconcile McNeil's theoretical studies on prostatic anatomy with ultrasound itself. That is, the image we see in front of our eyes. I think it's important to focus on the upper or lower parts of the prostate. The path of the seminal vesicles is the key. We're going to try to locate the urethra and use its position as a basis for a simpler echoanatomy of our head, even if, quite clearly, I don't think it's something that's obvious and clear-cut in books, and much less so in real life. So, if you've enjoyed it, don't hesitate to put a like, subscribe to the channel, and leave me a comment. Same thing on their Facebook. What's more, your introductory ultrasound training is free. The link is in the description. See you soon on ECHOMAP. Bye-bye.